Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. You are welcome to this parasitology lecture. It is about Paragonimiasis. This disease is caused by the lung fluke Paragominus westermani. The worm is also known as Japanese lung fluke or Oriental lung fluke. The adult worm measure from 7.5 up to 12 by 4 to 6 millimeters. It has a coffee bean appearance and a spinous cuticle as you see in the picture. The definitive hosts are mainly humans, also cats, dogs, and pigs. This is a life cycle, so starting from passage of unembryonated eggs in water to the first intermediate host, the second intermediate host, the infection and the pathology inside the human intestine and lungs, then passage of eggs in stool. So here, unembryonated eggs are passed in human sputum and stool. If this takes place in fresh water, the unembryonated eggs will inside them immature miracidia. The miracidia develop in the eggs and hatch after 2 weeks. The miracidia penetrate the first intermediate host, which is a freshwater snail. Within the snail, the miracidia develop into stages: sporocysts, redi, and ultimately into cercari that are shed into fresh water, the water. The cercari penetrate fresh water, crustacean, crab or crayfish, as you see them in the picture. Which is the crustacean is the second intermediate host, and the cercari insists in its muscle forming metacercari. Metacercari are the infective stages. Then humans are infested or infected all the same when they eat the infected crustacean containing the metacercari raw or undercooked. The metacercari exists and penetrate the duodenum, human duodenum, then the diaphragm, and lastly the lung, where they mature into adult stages. So it can be one lung or the two lungs. The other worms lay eggs in the lung, and then the eggs are coughed up and spit out or swallowed and pass in sputum and stool. The incubation period of the disease, it ranged between 65 and 90 days. And I'd like to mention that the infection may persist in human body for 20 years. The pathogenesis and pathology: once the worms are in the lung or ectopic site, so the worm may go to the lung and sometimes to the other sites. They stimulate an inflammatory reaction that allows them to cover themselves in granulation tissue, forming capsule. This is a protective step for them to protect themselves from destruction of the immune system. This capsule can ulcerate and heal over time. The eggs in the surrounding tissue become pseudotubercles. If the worm become disseminated and get into the spinal cord, they can lead to paralysis. And if that happens in the heart, the capsule in the heart can cause death, may lead to death. The symptoms are localized in the pulmonary system. If just there is no ectopic site. Here, the patient may present with cough, bronchitis, hemoptysis, dyspnea, and wheezing. The clinical presentation There are phases, the acute phase, and this is invasion and migration before reaching the lung. This is marked by diarrhea, abdominal pain, fever, cough, urticaria, hepatosplenomegaly, and sometimes pulmonary abnormalities in the first step and eosinophilia. Then the chronic phase, that is the pulmonary phase, the worm are there in the lungs. There are pulmonary manifestations including cough, expectoration, that is producing large amount of sputum. And this expectoration is of discolored sputum, that to say. And also there may be hemoptysis, and in chest x-ray there are abnormalities. The extrapulmonary, that in the ectopic sites, location of the adult worm result in more severe manifestation, especially when the central nervous system is involved, brain and spinal cord. The diagnosis is clinical assessment, then laboratory investigation, and then to take a specimen for laboratory investigation, sputum and stool. And then microscopic demonstration of eggs in the sputum or stool. And the eggs can be found after 2 to 3 months post-infection. However, eggs are also and occasionally can be found in pleural effusion or lung biopsy. Then serology, this to detect antibodies of the worm in light infection. It will be useful in light infection and the extra pulmonary infection. Then radiologically, plain chest X-ray, and the lesion may mimic tuberculosis, pneumonia, spirocheitosis, and then histological diagnosis by lung biopsy. This is the egg, you see, and its measurement about a smaller pole and a big pole. The big pole has got an operculum as the arrow is pointing. The treatment of choice is the praziquantel. The recommended dosage 25 milligram per kilogram body weight 3 times a day for 2 to 3 days. And the second drug of choice is the triclopentazole. So the first choice is praziquantel. And sometimes the disease or the situation may need surgical intervention to remove skin nodules or cyst, and that cyst in the brain or spinal cord. Prevention, improvement of personal environment and hygiene, and then cook fresh water, crabs and crayfish at least to 63 degrees Celsius and more. By this, the lecture is over. I hope that is understandable, and I wish you all the best.